Hello guys, today I'm back with another video and today we'll be discussing about the orbit of the eye. And this fellow wants to say hi to you all guys. So talking about orbit, it is pyramidal in shape and it is formed by four boundaries. One is superior, one laterally, one medially and the fourth one is formed by the floor. So we'll discuss all the boundaries one by one. We'll quickly isolate the boundaries of the orbit from this entire skeleton. The occipital, the parietal, both sides, the temporal, then we'll also remove the mandible. Right. Here if you want you can remove this vomer also. So this is the skeleton showing only the bones that forms the orbit, and here and there some few more bones, but the orbit is clearly isolated. So first we'll discuss the roof of the orbit. The roof is formed by the frontal bone here. As you can see, it is concave in structure, and apart from the frontal bone, one more structure forms the roof, and this is, let's just take this color, and it is this. So seeing from this side, one small portion of this bone forms the roof of the orbit. This is the lesser wing of the sphenoid bone. So this is frontal bone and this is the lesser wing of the sphenoid bone. Right. So now if you see that in the lesser wing of the sphenoid bone, you can appreciate this one structure, the foramen or a hole you can say. This is the optic canal, and if you see it from the other side, this it is over here. This is the optic canal on both the sides, on this side over here. So the optic canal form is present in the roof of the orbit on the medial side as a part of the lesser wing of the sphenoid bone. Other than this, here in the anterolateral region you can find a fossa. This is called as the lacrimal fossa, and this fossa will lodge the lacrimal gland. Whereas on the medial side, the anteromedial side, there is another fossa called as the trochlear fossa, and this gives attachment to the fibrous pulley of the superior oblique muscle of the eye. So these two bones will form the roof of the orbit. Next, we come to the lateral wall of the orbit. The lateral wall is formed, as you can see here, the sphenoid, the posterior part of the lateral wall is formed by the greater wing of the sphenoid bone. So let's just turn this structure up other side. Right. So this is the lesser wing and this is the greater wing, and this structure will turn the other side and form the lateral wall of the orbit, whereas the other part of the lateral wall is formed by this bone, and this bone is the zygomatic bone. Lateral wall is formed by the zygomatic bone and the sphenoid bone. as you can see over here, the greater wing of the sphenoid bone and the zygomatic bone. So the frontal process of the zygomatic bone will form the lateral wall of the orbit here. So when we take a closer look of this lateral wall, we'll find in the posterior part there is one segment, that is this segment, this bigger hole over here, and this is the superior orbital fissure, right? So we'll just turn this skeleton on the other side and we'll view it from this side. So this over here, as you can see, this is the superior orbital fissure. The optic canal and the superior orbital fissure. So this structure is present at the junction of the roof and the lateral wall of the orbit. So here, if you can appreciate, this is the lesser wing of the sphenoid and this is the greater wing of the sphenoid, forming the lateral wall, and the lesser wing forming the roof of the orbit, and the superior orbital fissure is present right in between the roof and the lateral wall. So there are this superior orbital fissure is divided into lateral, middle and the medial parts, and different structures pass through this. So from the lateral part, the structures passing is the lacrimal and the frontal nerves, the branch of the ophthalmic nerve, the trochlear nerve, superior ophthalmic vein, the meningeal branch of the lacrimal artery. Then from the middle part, that is over here, the structures passing are the upper and lower division of the oculomotor nerve, nasociliary nerve, and the abducent nerve. And lastly, from the medial part, the structures going through this superior orbital fissure are the inferior or ophthalmic vein, sympathetic nerve plexus from around the internal carotid artery. So that is about the entire lateral wall of the orbit. So far the bones forming the entire orbit are the frontal bone, the sphenoid bone, and the zygomatic bone. So this is the floor. So the floor is formed by the orbital surface of the maxilla, and the part of the zygomatic bone here, as you can see, is also forming the floor of the orbit. Here. So the orbital part of the maxilla and the lower part of the zygomatic bone. So the structures passing is the bigger hole, you can see it is the inferior orbital fissure. It is not basically a hole, it is a fissure, so we call it as inferior orbital fissure, and it is present at the junction of the floor and the lateral wall. So the structures that will be passing through this is the zygomatic nerve, the orbital branches of the pterygopalatine ganglion, the infraorbital nerve, and vessels. And another thing, as you can appreciate over here, this forms the infraorbital groove that eventually opens on the outer surface of the maxilla as the infraorbital foramen, and from here the intraorbital nerve will pass. Next we come to the medial wall of the orbit, and we have already recognized two structures forming the medial wall. One is this, the maxilla, the frontal process of the maxilla, And the another structure that you can appreciate here is this here. It is the body of the sphenoid. So body of the sphenoid, posteriorly and most anteriorly the frontal process of the maxilla will form the medial wall. Apart from that, we have this structure over here, and this is the left lacrimal bone, and this structure, this is the ethmoid bone. So the medial wall is formed by the maxillary bone, the lacrimal bone, ethmoid bone, and the sphenoid bone, the body of the sphenoid. We'll talk about the structures that are present in the medial wall. There is one lacrimal groove which is bounded anteriorly by the frontal process of the maxilla, posteriorly by the lacrimal crest of the lacrimal bone. So here there is one groove which is called as lacrimal groove, and it will lodge this groove. You can see it will lodge the lacrimal sac, and this lacrimal sac will lead inferiorly from this structure into the inferior meatus of the nose here, up till here, right? So that was about the boundaries of the orbit, which is, again we'll revise that. The roof is formed by the frontal bone. Another part is formed, the posterior part of the roof is formed with the lesser wing of the sphenoid. The lateral wall, the posterior part of the lateral wall is formed by the greater wing of sphenoid. The anterior part of the lateral wall is formed by the frontal process of the zygomatic bone. The floor is formed by the zygomatic bone and the orbital plate of maxilla. The medial wall is formed by the frontal process of the maxilla, the body of the sphenoid, the lacrimal bone, and the ethmoidal bone. One thing that has to be noticed over here is that medial wall of the orbits are parallel to each other, whereas the lateral walls are not parallel to each other, right? The lateral walls are not parallel. So when these lateral walls are extended posteriorly, their tangents will meet at 90 degrees. You can see from here also, and I hope you can appreciate that these walls, they seem to be flaring in an anterolateral direction, and when these tangents are drawn in posterior, extended in posterior direction, they will meet at 90 degrees. So this was all about the orbit. I hope you guys liked the video. Thank you.